ProAir RespiClick albuterol sulfate inhalation powder is indicated in patients 4 years of age and older for the treatment or prevention of bronchospasm with reversible obstructive airway disease and for the prevention of exercise-induced bronchospasm. ProAir RespiClick may seem different from other inhalers you've used before, but don't worry. Click and Clark are here to help. Let's go over a few do's, don'ts, and how-tos. Okay, ready? Let's go! First, don't use ProAir RespiClick if you are allergic to albuterol sulfate, lactose, or milk proteins, okay? Then, before you use it, always make sure the red cap is closed. And check the back to make sure the number of remaining doses on the dose counter is greater than 0. ProAir RespiClick doesn't have a canister or button to press, and it doesn't need to be primed or shaken before you use it. Then, hold it upright. To load a dose, pull the cap all the way open. You'll hear a click, which means your inhaler is ready to use. But don't open the cap unless you're taking a dose. You'll waste your medicine. Okay, now breathe out as much as you can. Don't breathe out into the mouthpiece. Then, when you're ready, place the mouthpiece between your lips and be sure not to block the vent above the mouthpiece with your lips or fingers. Ooh, that's an important vent. After breathing out, breathe in quickly and deeply through your mouth to deliver the dose of medicine to your lungs. Now, remove the inhaler from your mouth and hold your breath for 10 seconds, or as long as you can. Then, breathe out and close the cap. Because ProAir RespiClick is a dry powder instead of a spray, you may not taste or feel it. So don't take an extra dose from the inhaler even if you do not taste or feel the medicine. But don't worry, that doesn't mean it's not working. Check the dose counter on the back to make sure you received the dose. If your doctor has told you to take 2 doses, let's repeat the steps you just learned. You should start feeling the effects within about 5 minutes. But always remember to close the cap after you're done and keep it closed when you're not using your inhaler. ProAir RespiClick is designed to be used without a spacer. In fact, you couldn't use a spacer even if you tried. If the numbers on the back get below 20 and the numbers turn red, that means it's time to get a refill on your prescription. ProAir RespiClick doesn't need to be washed either. Whatever you do, don't get it wet. It'll ruin the inhaler, and you'll have to get another one. But you can wipe the mouthpiece with a dry cloth or tissue if you want. Store your inhaler at room temperature and keep it out of reach of children when not in use. And don't ever take your inhaler apart. That's not cool. If you ever have questions about your ProAir RespiClick inhaler, ask your doctor or go to proair.com/usage for more.